I don't know if any of you have had this experience, but when you find something in writing that perfectly expresses what you feel inside, it's almost a religious experience. And so I found a 2009 report by the Social Security Advisory Board about the rising cost of health care. And there's about 30 pages documenting what we all know, that the cost of health care, in their words, is the number one threat to the future stability of our economy. And it's well documented in the United States, the per capita cost of healthcare delivery is 2 to 3 times more than anywhere else in the civilized world. And it's like complaining about the weather, right? Everyone was talking about it, but what are we going to do about it? And what they cited when they got to a solutions section was exactly what I was hoping. They said, we need to take an engineering approach here. They cited a physician who had success in adopting the methodologies of Deming. Deming is the father of quality systems, largely ignored here in the United States, adopted by the Japanese, by which they then built their automotive empires. And we are still now slowly catching up and learning the lessons. But the message was, and I'm going to quote this so I get it straight, Deming claimed that if you improve your quality, your cost should also drop. And as you understand the mechanisms, you can get a win-win going. You can win on both sides of the line. Better clinical outcomes can drive lower costs of operations in a predictable way that you can manage. Wow. Right? So you can get better quality and lower costs at the same time. Why? The story behind Deming is an engineering mindset. You have to understand a systems view of things. And as we looked at the healthcare system, it wasn't a system. It was a bucket of bolts. You know, in a manufacturing enterprise, in automotive manufacturing, you have a system, but there's a brain in the system. There's a tier 1 OEM or an OEM. There's a Ford, then drives the design and decisions all the way down the line. And that kind of centralized command and control allows you to have cooperative parts of a system. But in healthcare, we had individual physicians, we had physician groups, we had hospitals, we had clinical labs, we had pharmacies, we had payers, and all the other chowder of folks engaged, each trying to do its best to improve its own lot. What else could they do? But nothing creating a cooperative view of how this thing works around the patient as a system to deliver better quality health care. And so it began with a dream. It materialized first in the early wave of digitizing healthcare records. And so getting you in a place where you could begin to make connectivity between these independent parts. It embraced the development of healthcare information exchanges. Again, something that Tom had pioneered before there were federal funds to do it. And now it's turned into a statewide effort and initiative and a national program as well. These are all the sort of hidden stories of Obamacare. All the dialogue and debate is about the insurance model, but nothing about the billions that were spent to create a digital exchange system and digitizing the healthcare system that has a potential for huge impact. And now the group has continued to use that as we hoped, not with the IT as an end, but the IT as a means to achieving these quality outcomes. But I don't want to lose the systems message because, again, you can't independently optimize the circulatory system, the respiratory system, and the digestive system. I hate to imagine what evolution would have done to us if all of our systems were allowed to independently evolve around their own needs and not around the coordinated effort of making us the beautiful thing that we are. And so how do we do that in a world in which there isn't centralized command and control? I mean, I'm a child of World War II vet. We've grown up in that era where American business was modeled after the military success in World War II, and it was centralized command and control, and everything was organized. There's the plan, let's go and take the hill. Perhaps healthcare becomes a model of how industry needs to move also, as they lack the ability to be fully vertically integrated and perform that way. And so the ambition for events like today is really to bring together all the elements of a system and see if we can conjure up collectively ways in which we can use tools, technologies, and just people systems to improve quality and drive down cost at the same time. It all becomes possible when you understand the system, you understand how the boxes align, you understand the interrelationships between them, and you understand what you can change without boogering up all the others. And that's the approach that engineers use regardless of what their profession is. It's understanding the decomposition of a problem, or an operation or a physical entity in its component parts, like a family tree, understanding what goes on inside those boxes, the information or material exchanges in between, and where you can now start to change the way that you accomplish the elements of a system without damaging the way everything else performs. And I think that's our hope today, is that the conversations are going to lead us to those kinds of conversations where we can hash out and arrive at ways that will achieve the dream. A faster, cheaper, better is the commercial sector side of this. Higher quality health care, lower costs, greater accessibility, improved outcomes for everyone. That's our dream. I think our trajectory is the correct trajectory. The vectors, as they would say in physics, are all pointing in the right direction.